So, what have been some lessons learned along the way as you've endeavored to make these changes, as you have seen some of the ways things have turned out, right? What have been some of those lessons learned?
I think the number one lesson I've learned is that people are very resistant to viewing individuals who are using substances as people because it's difficult for them to decategorize them, I guess, or humanize them. And so hiring staff and supervising the staff in all their interactions until they really have this philosophy and paradigm shift down is difficult because you find yourself having to talk to them constantly about why they're struggling with. We hired a new shelter manager once, and it took her 5 or 6 months for her to really get and understand why we don't punish people who use drugs,
Mhm.
because everything she's ever known, and this is the same for most staff, especially in a rural, very conservative area, is we don't have the pick of the litter for staff sometimes. And so we have to be content and actively okay with bringing on staff and giving them the tools and the education and the training that they need, because we know once they see this stuff they're going to come to the same conclusions we have. You can't see it and live in it and work with it and not find the humanity. And so we know they're going to get there, but we have to watch them because they are not at risk, the clients are at risk. And so we don't want any of our staff to be capable of throwing away years of hard work because of a really terrible interaction they may have with a client that's laced with judgment. It could undo everything that we have been working towards. So, trying to fix the processes that we have around training the staff and supervising them and helping get to a place where they can be fully bought into our philosophy around the way that we do this is it's hard. It's very hard. And there have absolutely been staff who couldn't accept that and had to move on. And that's difficult as a program to lose people, but to also value that philosophy so much, to say it's that important that these individuals have safety just like anybody else. And so if our staff aren't on board, then they can't be our staff. And that was difficult for our program. Let's see, other lessons learned. It is everywhere and everyone has some exposure to it. Once we created more safety for our clients to talk about it, we would hear about the first time they were ever introduced to alcohol or introduced to cocaine or introduced to marijuana. And it was not in their 20s at college. It was when they were 10. It was when they were 7. And it's really difficult to hear that, but it also helps us to be able to understand how important it is for us to now be involved with our prevention coalitions addressing underage drinking and underage vaping, and having a voice in the room that can speak in it to our experience with how they're growing up to be as adults and what dangers they've faced, to say this is why it's important and this is why we have to come at it from this angle, because we're seeing the after and we're invested in making sure survivors in the future, and hopefully we can solve domestic violence too, but the reality is probably not very soon, but we can make sure that we have better programs and better community based types of things to be able to get involved. So we've had some lessons learned that we can't just operate in a silo of domestic violence and sexual assault. We have to reach out and participate in all sorts of different arenas in the community, because all of those pieces have created a perfect storm for a lot of the survivors we work with. The other one is education. Individuals who, didn't finish high school or had really terrible experiences in bullying or sexual assault by a teacher or by a coach or a religious leader. And so it has really been something that I think has helped us understand we cannot sit in a silo. And I think it gives us a little more power. And we bring we ask survivors who we're not currently with or have left the program after a certain amount of time. We give them all those resources to say, if you're passionate about this, we could really use your voice in these spaces because you've experienced that. And if you're comfortable with it, here's the information. We'd love to see you there. And because we need you to help us solve the problem. So it's been really cool to kind of see how our work takes us in so many different directions.